Hello everyone and welcome to my channel. Today I have one of my models who is going to help me practice my back massage routine. So I'm just going to check in with her to see that everything is okay, and then I'm going to cleanse the back and check for contraindications before we go into the full back massage routine. So is everything okay for you there?
Yes.
Thank you. And I have got the heating on, so I'm prepared for when we need to get to the back massage and take the blanket off. Hopefully the room is nice and warm for you still. Okay, thank you. Okay, now we have spent a little bit of time discussing the routine today, and in particular we discussed that you have a little bit of a reaction to when we use essential oils. So what we have decided today is not to use essential oils for the massage. We're just going to use a basic carrier oil. But what I want to do first is just cleanse the back completely, and bearing in mind that you do have a sensitive skin, I'm literally using micellar water to cleanse the back so that there's no chance of a reaction at all. This is going to be quite cooling on the skin. And this just gives the back a little bit of a cleanse. Removes off any impurities that are left on the skin. Covering any areas that I'm going to touch. Okay. And then what I'm going to do now is just check your back for any contraindications. And the reason we do this is really just to check for any broken skin or any possible sign of bruising, anything that's tender. So do give me a shout if there is anything that you suddenly feel is tender when I touch, or if there is anything that you're aware of that I need to know about with regards to your skin. And if I've got any questions as we go along, I'll ask those as well. So I'm going to start from this side, and I'm going to just go all the way down. And the magnifying glass allows me to see any possible contraindications that I can't see generally. I can just see a bit more. Okay, and you've got a slight scarring here. Is this a mole removal? Okay, it's an old one though by the looks of it. Okay, right. That's absolutely fine. It looks like it's healed up there. And the others are just literally age spots which we can work over, no problem. But there's no open sores or anything like that. And there doesn't appear to be any tenderness anywhere. Okay, I'll just cover the top of the shoulder here. Okay, that is lovely. Thank you. I think we are good to go. So, as I mentioned, you've got a slight sensitivity to essential oils. So, what I've decided to do is just use a basic carrier oil, and this one is wheat germ. So I've gone for a sort of middle of the road carrier oil. So I'm going to start with applying the oil to the back. So we start with a generous amount first. We just gently effleurage to make sure that the oil seeps into the skin. Okay, I think we just need a little bit more. And you can nicely relax while I'm doing that. So what I'm going to do now is just apply my fingertips to either side of the spine and just move from the neck down to the sacrum. And what I'm trying to feel for is any tender areas. So we never massage on the spine, just down it, either side. Right, next I'm going to use my thumbs, place them towards the spine, and then I'm going to use what we call a petrissage movement, just to see if there is any tension in these spaces, the intervertebral spaces. And that really helps to release any tension and stress that are in these areas. Back massage is so good for this. It just really improves circulation as we increase the blood flow. Really helps our muscles recover by carrying oxygen and nutrients to all these lovely areas. going to move to the side. And then what I'm going to do is just do what we call whole hand frictions to the back. And we're doing a relaxing back massage now, but obviously what you can do is also do a really vigorous one if you want to. So you would then shorten the massage and your movements would be much sharper and much faster. Right, we're going to get to this sacrum area. People hold a lot of stress in this area, so massaging this always feels absolutely wonderful. Really helps to reduce the stress that we often find in lower backs. What you're trying to do here is just reduce those cortisol levels that cause stress. And often if you're sat for long periods of time, which many of us are, this area gets very tender, so working it is a nice release. Reduces any inflammation in there, allows you to recover from sitting endlessly. And do try wherever you can to get up and move around at least once an hour. But I know sometimes people can't do that because of their jobs. And then a massage, just a straightforward back massage like this, can really, really help release that stress and tension in this area. So what I'm going to do is just deep thumb lead some of these areas around the shoulder and neck that were quite tense earlier. So what I'm going to do is just do some deep kneading into the areas around the scapula. People often get very tense in these areas. I can feel lots of crunchiness here. And that's, we just use these areas so much. Deserves a little bit of TLC. Just drain it down the lymph node. Just going to pick up this area just a little bit. Don't want to pull on your hair, so I'm just popping it out of the way there. Okay. Right, so I'm just going to do the other side. Obviously, you would normally move actually round to the other side, but we can't do that, otherwise you'd only see my back on the camera. So what I'm going to do now is I'm just going to pull the blanket up so that you don't get cold, and I'm just going to work, I'm going to bring my chair back, and then I'm just going to work this shoulder and neck area a little bit more. I'm going to put a little bit more oil on the tops of the shoulders where they've got a little bit dry. It's useful having you here because I've just learned that I need to be much closer when I do this, so that's helpful. Take that down a little bit. Lots of tension in these shoulder areas. That's not unusual. Anything from jobs to shopping, cleaning. We use these parts of our body a lot. They hold stress. If it's not the lower back, it's the shoulders. So just a simple massage like this can really help. The beauty of something like this is that a general massage in any form really is a relatively safe treatment, and it's non-invasive. Do always consult your doctor if obviously you suffer from any chronic illnesses. But potentially anything that can be impacted by this treatment, then obviously always best to consult your doctor first. But generally, a basic massage like this, as I said, is non-invasive and can really help with stress levels and easing tension. Just going to massage the base of the neck here. I know you said earlier that you're going out and you don't want any stickiness on your back. So what I'm going to do is just remove, with a little bit of micellar water again, the massage oil that's sat on your back at your request. Normally you would leave that on there, but as I said, we haven't got essential oils in there, so it's quite easy to actually remove that. So I'm going to do that now. So as we did before, we're just going to use micellar water for this. And this is very useful for anybody who's got sensitive skin like yourself. And those carrier oils are great as a simple massage medium when you've got somebody with sensitive skin who reacts to oils. And they're very useful themselves. So just going to do the same on your shoulders. that's the end of the back massage routine, and thank you so much for coming in and allowing me to practice on you. I really appreciate it. Thank you, and thank you for watching. Hello everyone, and welcome to my channel today. Today I have my model with me who is going to help me on my journey of relearning where all of the acupressure points are on the body, with a view to eventually covering as many of these as possible. So the first thing I'm going to do is cleanse the back, and then I'm going to do a contraindication check, because today what I really want to focus on is looking at the acupressure points for back pain. So I'm just going to pull down the blanket, and I have got the heating on so that my model remains nice and warm. Just going to pull that down slightly. I'm just going to cleanse the back first. Now, this particular model has a sensitivity to creams and oils with scents in, so I am literally using micellar water so that it's nice and free from any fragrances. Okay. And then I will do a contraindication check today. It's not so important today because we're literally just touching acupoints, but it's always worth, when you're touching somebody's back, just to double check that there's nothing on there that could cause pain or discomfort to the client. So I'm just going to give a quick check, starting this side, just checking all of this out. And please do shout if anything feels tender at all. I know that you've got a couple of age spots here and a scar from where a mole has been removed, but we're not actually going to press on that area today, and it's all healed up. So nothing feels tender at all? Mm. Okay, that's good. As I said, we're not really massaging today. This is really just to see if there are any areas that I might need to avoid. Okay. Okay, that all seems fine. So, what I'd like to do is talk to you first of all, I think, about acupressure generally, because I'm really quite fascinated by the subject. So it was originally a traditional Chinese treatment based on the principles of qi, or energy that flows through 14 meridian or energy pathways in the body. And you apply pressure to various acupoints along these meridians. Sorry, start with that again. So you apply pressure to various acupoints along these meridians to strengthen the flow of chi that I mentioned earlier and remove any blockages that you have along these meridians. And this can really help to relieve pain and improve common ailments, and also help to promote a sense of overall well-being. Now, I studied this topic very briefly as an option on my holistic diploma course, but I'm still fascinated with it and I never got to study it fully. So I'm really sharing my learning journey with you, and I've touched on some of the areas before, but I really would like to get more depth around some of these acupoints and slowly work my way round the rest of the body. So to help me do this, I've got a couple of reference documents with me. So one is this wonderful book called the Acupressure Atlas by Bernard Kolster and Astrid Waskowiak. And it's fascinating, it's very detailed, and it's very much broken down for somebody that is learning or relearning acupressure generally and where these acupressure points are. And I will be using the pages associated with back pain today. So I'll be reading out some of those areas. And with it comes this wonderful acupressure chart. So we're looking at the back today. So I've got the back there. But there is also the front version as well, with the hands and the feet and the ears covered as well, with all the meridian lines on here. And these are the three main ones, and there's a little group here that we're going to look at as well today. So we'll study those in a little bit more detail. But it's really useful when you're relearning something like this. And obviously you can look it up online, but it's really helpful to have something that you can have next to you, whether it's via your iPad or your laptop, or indeed a good old-fashioned textbook, which I actually quite like. So this wonderful diagram that I've got here covers 361 points, so you can see that there's an awful lot to learn. The concept itself is based on beliefs from over 2,000 years ago, and acupressure is practiced by thousands of people worldwide and is a way of relieving common aches and pains. It's not a substitute for medical treatment, but it can be complementary to this. And you do need to be aware that caution needs to be used for those people who are pregnant or have cardiac issues, because it can overstimulate certain areas. So always check with your medical practitioner first. But an acupressure point is a point of increased sensitivity located along these meridian lines that I mentioned earlier on the diagram, and there are 14 of them. So I'm just going to run through the ones that... So I'm just going to run through the names of the 14 main meridian lines. So you've got number 1, which is the lung. You've got number 2, which is the large intestine. You've got number 3, which is the stomach. You've got number 4, which is the spleen. Number 5, which is the heart. Number 6, which is the small intestine. Number 7, which is the bladder. Number 8, which is the kidney. Number 9, which is the pericardium. Number 10 is the triple warmer. Number 11 is the gallbladder. Number 12 is the liver. Number 13 we have the conception vessel. And number 14 is the governing vessel. And as I mentioned, there are 361 acupoints along these meridian lines. And these specific acupoints have the most wonderful names. I mean, how people memorise these, I don't know, but some people do. But today we're going to just be looking at 3 of these. So we're going to be 3 main ones, and then a small group that are located on the lumbar spine. But for the main ones that we're going to be looking at, it's a governing vessel 3, which is known as lumbar yang pass. Governing vessel 14, known as great hammer. And the gallbladder 30, known as jumping round. As I said, they have the most amazing names associated with them, and I have great fun looking at some of these. They also have Chinese names as well, which I won't even attempt to pronounce, but these are the Western ones that have been given to them. And then we're going to be touching on the lumbar spine area, which we're going to be warming up, and the sacrum region as well, where people have a lot of their pain. So what I want to start off with doing is just reading out a little bit of the reference material so that you get a feel for how I'm relearning all about acupressure. So they say the most common cause of back pain is bad spinal posture. Even in children, damage to the spine from a bend to one side or to the frontal back is not rare. The nature of leisure activities has changed, and both children and adults now spend the majority of their day in a sitting position. As a result, the muscles that support the spine are not used sufficiently and begin to atrophy. At the same time, the muscles of the buttocks, neck and shoulders carry an excessive burden that often leads to tension and pain. Sometimes even small movements initiated from a bad starting position can be enough to cause an unbearable pain in the lower back. This condition is known as lumbago, and it's characterised by pain in the lumbar spine. In Western medicine, back pain, including lumbago, is frequently categorised as functional, meaning that no organic cause for the symptoms can be detected. And indeed, you can often hear about people going away for tests and they can't find anything. And what they're saying here is really look at how you're sitting and what you're doing. So what can you do? So all activities that strengthen the back help prevent back pain. So learn behaviour that is good for your back in everyday life and make a habit out of it. Many physiotherapists and even community centres offer courses on improving back strength. And if you experience lumbago, warm, damp wraps and a hot bath can alleviate the acute pain. Obviously, make sure that you consult your physician as soon as possible if you do have severe back pain. So, how can acupressure actually help with this? So, in contrast to our Western experience, traditional Chinese medicine sees wind and cold as the most frequent causes of back pain. These two factors are the focus of acupressure treatment, especially in the case of sudden onset pain. Massage of the points, which we're going to cover, is helpful in alleviating back pain, and a successful course of treatment also includes rubbing the lumbar spine and warming the sacrum region through rubbing. Please note that governor vessel 3 must not be massaged in the case of pregnancy. Okay, so what I'm going to do first is look for the first major acupoint associated with back pain, and that is governor vessel 3. As we know, that's lumbar yang pass, and this point is located over the lower spine below the fourth lumbar vertebrae. Feel for the upper edge of the pelvic bone and locate this point at the level on the spine. And I have my wonderful diagram to help me as well. So we're going to go down the back and we're going to locate that, which is about here. And then it says you massage the point with the tips of your thumbs, applying steady and then circulating pressure, first clockwise and then counterclockwise for 1 minute each. So we've got that here. Yes. So you put pressure and then you circle clockwise. And then counterclockwise. Obviously that is not quite a minute each, but you get the general gist from that. And then you rub that area with your palm for up to 3 minutes. And you can imagine, if you are suffering from back pain, the relief that this actually gives is really nice. And if you think it's almost sort of in the middle of the back, this book is so good because it actually gives you some diagrams to follow as well, which is very helpful. So then the next point we're going to look at is governor vessel 14, known as Great Hammer, and that is located on the spine between the lowest cervical vertebrae and the top thoracic vertebrae, so it's up at the top here. And I've got my other diagram here. So 14 is, let me get down from the head. There we go. So it is right there. So it's almost on a par with governor vessel 3. Governor vessel 3. But obviously towards the thoracic area. Okay. It does say sometimes it's easier to locate it by bending the head slightly forward, which we can't do now, which causes the dorsal process of the lower cervical vertebrae to protrude slightly, and governor vessel 14 is just below that. So again, we're going to do very similar to what we did before, which is pressure down there for a minute or so, and then you would do clockwise movements. And then anti-clockwise movements as well, but for a minute each of those. And then you would rub the points and the skin around it with your palms for about 3 minutes. And that's just to relieve the feeling of the pressure and to really warm that area up. That's really fascinating. Right, over the page, and we've first of all got the rubbing of the lumbar spine. So at the level of the upper of the pelvic bone, rub from side to side across the back with the palm of your hand, applying slightly stronger pressure when you're moving your hand away from yourself. So I think what they mean is very gentle in the middle and then more pressure. That's it. More pressure when you're moving away from yourself there. That's it. There we are. Got that. And that is really designed to warm up that lumbar spine area. They've got some wonderful visuals in this textbook which really help you understand what you're doing. And it does say continue that for 3 to 4 minutes. And it creates a pleasant warmth on the skin. Okay. Then our last main point is Gallbladder 30, known as jumping round. So Gallbladder 30 is, actually we'll take these two off because we've done those two. Gallbladder 30 is right at the bottom here. So gallbladder slightly to the right of the spine, and it's right down there. Okay, and it said it's easier to locate this point with help from your partner or your therapist. Okay, imagine a line running from the bottom of the sacrum. Okay, yeah. And if you did the line, okay, gallbladder 30 is located in the spot that divides the middle to the outer third, so that's just about here. So rub these muscles for 2 to 3 minutes with the balls of your hands, moving your hands from the middle of the body across the large muscles to the outside, and then less pressure back to the middle. Then massage gallbladder 30 for 2 to 3 minutes using steady and then strong circular pressure. And that's back with this. First clockwise and then counterclockwise. And it does say here this needs to be quite pressurised, but I would just take great care. You need to really keep asking the question whether the pressure is too much. because some people who are not used to doing this can push really hard. So you want to measure through communication how much of that pressure you want to use. And then we've got the warming of the sacrum, so slightly further down from where we were before. So the points urinary bladder 27 to 35. Now on our wonderful diagram, 27 to 35 is like this whole group at the base of your spine there. It's a whole group of acupoints all in that area that need doing. So rubbing the area activates these points. This massage is best done by somebody else. So, okay, rub from side to side across the sacrum with the palms of your hand. Make sure that your palms remain in steady contact with the skin, which is necessary to create a warm sensation, and massage the sacral bone in this way for 4 to 5 minutes. So that's actually quite a long time. Feels like this is a workout. But that will really warm up this area. Now, with many of these, you can do it without clothes on or with clothes on, or maybe if you're going to be poking around on the back, you can clear the back but keep the rest of the body covered. Many of the diagrams here show people in various states of dress or undress, so it's whatever suits you and what you're comfortable doing. But I just find the whole concept of acupressure just totally fascinating, and I really want to continue learning more about it. So next page is on tennis elbow. I'll be really interested in looking at that one later. Okay. So hopefully that's given you a little bit of an insight into what I'm doing at the moment, which is relearning about the whole of the acupressure setup as a complementary therapy, and totally fascinated by some of not just the history but where you can actually feel some of the pressure from these points that you're putting pressure on, and you can actually feel the reaction in your body, because some of this you can do yourself, some of it is helpful to have a partner to do it with. But by learning where the acupoints are, you can build up enough knowledge, I think, to provide a good acupressure treatment. And as I said, this has been used for years to really help get these energy lines clear and deal with some really common issues that we all suffer from. So that brings me to the end of this session, which was all focused around back pain, but also focused on my fascination with acupressure, and I hope to build up my knowledge of this over the next months or so that I can eventually give a full acupressure treatment. But as an enhancement to well-being, I think it's a good complementary treatment to have. And I hope that you have enjoyed this introductory session. So thank you so much for watching.